as it runs to the pericardium, the phrenic, and this one is the gold here. It usually runs on the right side. It runs usually up and down the SVC, through the pericardium, down the IVC, on its way to the diaphragm. On the left side, I don't have the phrenic labeled on this one. I think it's cut out. I think they were like removed the pericardium entirely on this side. Now, as far as vessels, the left brachiocephalic vein is this one right here. It usually stretches across the chest. I've got it cut and removed so you can see the arch vessels. You have the brachiocephalic trunk is the first arch vessel. The arch of the aorta you really don't even see much except for kind of where I am, but it turns and immediately goes back down. The descending aorta, which you really kind of have to move the lungs and stuff out of the way, but if you look, it's the big pink tube that goes down the chest. So the descending aorta is got connective tissue over it, but it's basically right here. Alright, so that goes down to the thorax and the abdomen. It's called the thoracic aorta or the abdominal aorta, depending on what region it's in. But that's the descending aorta. The brachiocephalic trunk is the first arch vessel. The second one is the left subclavian. If you follow the left subclavian, it goes right up to the top of the ribs here, about this area right here, and goes out to the brachial plexus, out to the arm. Brachiocephalic trunk splits, so you have left common carotid, just follow it all the way up to the left side of the neck. Again, you see the vagus nerve runs along that. You've got the right common carotid, which is always your middle branch out of there, and then your right subclavian, which is this one over here. It goes out to the again out to the right arm. All right, so this one you have left common carotid branch off first, then you've got the two right sides branch. All right, so again, there's always variation. Now the sympathetic trunk, it's usually a challenge to see, and I do have it labeled in this one. If you remember your spinal nerves, as you go up and down the vertebrae, spinal nerves exit and go out horizontally. All right, sympathetic trunk runs vertically, basically connecting all those nerves. That's your sympathetic nervous system. So the sympathetic trunk here is this black thread. All right, it's always going to be running along the ribs. It runs straight up and down, kind of under some connective tissue, a little bit of fat, so it is kind of a challenge to see. But if you're looking at a little white thread up and down ribs, that's the sympathetic trunk. And again, it is bilateral as well. And yep, I've got it labeled on this side as well with a little black thread here. Again, sometimes you've got to dig it out from under the descending aorta. On this side, I don't know if you guys will hit the veins or not, but it kind of runs right along the azygos vein, big blue vein that drains the thorax. Other stuff on here you want to know: pericardium itself, mostly removed, but there's the pericardium is cut. Lungs, mostly removed as well. You've got lungs here, a little bit here. A lot of those have been removed so you can see better. The diaphragm is here. Okay. Again, you should be able to see the phrenic nerve as it innervates the diaphragm. Now, review the abdominal stuff as well, okay, because we'll have some abdominal on here. Remember, this is the liver. Got the gallbladder. Oh, little green sac in here somewhere. Oh, it's right here. It's actually usually green, but there's the gallbladder. Stomach. Omentum is completely gone. You had a little bit like right here, but remember the omentum is the yellow fat grape. The mesentery is the arterial system that goes out to the small intestine. Large intestine, uterus, you have here and here, urinary bladder on the midline, kidneys, deep in a little fat pad, retroperitoneally. Pancreas, sorry, spleen is this one right here. Pancreas is